Hello, I'm Dr.ND. Whenever I ask my telemedicine patients what type of diabetes do they have, type 1 or type 2, so in most of the cases they are not aware of it and they are not able to tell me. So I decided to tell you how to determine which type of diabetes do you have. So there are many ways of determining whether you have type 1 diabetes or type 2 diabetes, but there is a one very simple test, simple blood test, which is called C-peptide. So if you do C-peptide in your blood and if its value is very low or almost nil, so this indicates that you might be having type 1 diabetes. And if the C-peptide is in normal range or high, so it indicates that you might be having type 2 diabetes. So this is a very simple and very important test to determine. Besides this, there are various other tests also. In type 1 diabetes, many autoantibodies are present. So if you test for these autoantibodies, for example, GAD65, insulin-associated antibody, islet cell antibody, gene transporter antibody, so presence of these antibodies indicate that you have type 1 diabetes, and if these antibodies are absent, so it indicates that you might be having type 2 diabetes. Besides this, there are various other features also. In type 1 diabetes usually presents in children and teenagers or very early age, in less than 25 years. And type 2 diabetes presents after 30 years and middle ages. Usually these days, many young children are also having type 2 diabetes, but this is the classical presentation. It occurs in old age, middle age and old age, and this type 1 occurs very early in children or teenagers. Then type 1 diabetes, usually first time presents with diabetic ketoacidosis, whereas type 2 diabetes is slow onset. So in this way, there are many ways which doctors use to determine whether you have type 1 diabetes or type 2 diabetes. But the C-peptide blood test is a very simple test which can definitely give you a very important clue about what kind of diabetes do you have. So I hope this video will be important. Will give you important information to you, and you will be able to utilize it to determine the type of the diabetes you have. Thank you so much.